Surgical hand wash. Surgical hand wash is the same. Normally this thing is not ideal for surgical hand wash because if you notice, my hand's position is pointing down, right? Did you guys notice that? Now watch me with a surgical hand scrub. Surgical hand scrub is different. After this demonstration, my hands will be one of the most sterile hands in the city of Roseville. So I will open first my brush and lay it on the counter. You guys with me? Without touching the inner part of it. I remove all of it already, yes? Now I'm going to, I don't need that. No, I don't need I don't need this. What I need is, Haley, can you give me special? Kind of like, there you go.
Special.
Like, yeah, making sure this dry. So, this will be out of my hand dryer later on, my sterile towel. So, this will be a pretend.
Really wet.
I know. Okay, this is good. This is good. Okay. This is almost like clean. All right. So first thing first. Remember, first step: remove all your jewelries. Yes. And then roll your sleeves or do this long sleeve. Then you do your, get your hand wet from the front to the elbow. Get the other hand wet, front to the elbow. This is a 3 to 5 minutes brush. First, you have your cuticle stick. It comes with it. Under the running water, you try to use the cuticle stick to clean underneath your nails. Normally in the surgical suite, this running water continues to flow, yeah? But because it's motion sickness, I don't want motion sickness. So this, I'm demonstrating to you the proper way of doing it under the running water, yes? And make sure that your water is not too hot because it can dry out the skin, yes? When you're done cleaning underneath your nails, you drop it on the sink. Get this, see the bubbles? This is a time for you to be a kid. Then saturated water, squeeze it to make sure that you apply a lot of what? Soap in your hands. So now I'm going to start brushing with a brush side. I'm going to start with the tip of my fingernails. 1, 2, one hand at a time. So I'm right-handed, so I'm going to brush my left hand first. The tip of my fingernails, the side, 4 sides of your fingers, 3, 4. Are you guys following me? Make sure that my body doesn't touch the sink. I don't want to be a Mercedes-Benz or the Mustang for microorganisms. Now this is not the time to say, oh, I want to look sexy and flawless. No, this is not the time. You're going to look really messy. That's why you need to wear scrubs, yeah? When you're done with your fingernails or your fingers, then you start working. See the circular motion? You don't go back and forth because the microorganisms will get a headache. So you start from the tip and brush them down. This is the soft part, or soft side of the brush. That's what you use for the back of your hand because it's a sensitive part, right? If it is too dry, get more water, squeeze, then continue. You cover inch by inch of your hand. Yes, yes, baby. Okay. The 4 sides of my wrist, all the way to
Your
elbow. Are you guys with me? I'm done with my left hand. Switch. Start brushing. There's a time that the surgeons and the MAs are trying to set up their date. There's a time to really establish that bonding when you're brushing. This is like a 5-minute conversation in the room. So that's why you need to have. Yeah. I'm sorry?
They showed this on Grey's Anatomy.
Yeah.
That's what most are talking about this.
That's how they talk about it. Yeah. So now you notice that I am brushing and my hand is pointing up all the time. Yes? And I'm going to tell you what is the rationale behind my hand pointing up. What did your book say?
So that your germs don't go back down to your arms or to your hands.
Yes. So that the microorganisms will not be flowing back to your hand. It's all going to the elbow because the elbow doesn't touch the patient. So you're fine. Yeah. Okay. So when you're done, you just drop them on if you have your trash there. If not, drop them in the sink and let the janitors pick it up. What you need to do is then rinse your hand one at a time without touching the sink. The moment you touch the sink, you're again what? You contaminated your. And then one more. Oh man, my hands are so dry now. You cannot touch anything after this. So if you have a bigger sink, you just like, that's what the doctor does. That's how we do it in the OR. And then obviously, sterile hands coming through. So who can give me a paper towel? Now, long one. Okay. Make it longer if you can.
You can't make it any longer. It
It
just tears off each
okay.
time.
Alright, so that's fine. So let's pretend this is a sterile
This is
towel.
sterile.
Sterile towel, okay? This pretend sterile towel. This long. Okay. So I'm gonna dry one hand at a time. From the tip. Yes. From the tip of your hand or fingers, then you work yourself down to your elbow. And then you switch over the other end of your towel, the unused end, and dry the other hand. Make sense? This is how you're going to be performing it. Now you'll notice that your shoulder needs some rubbing now, right? Now can you rub my shoulder, baby? I'm so tense. So, that's how the doctors and the nurses in the surgical room, that's what happens. Oh, it's so tense. Can you rub it a little bit better? Stronger? Well, they love it, baby. All right. You ready? Still hands coming through. That's how you perform the procedure.